Good morning. This is Dr. Bhupesh from Dr. BKM Institutes once again. Today we are going to discuss this session, which is primarily focused on speaking. So just going to discuss this session so that everybody can understand and can learn from the session the maximum we can. So basically in OET speaking, there are two tasks. So OET speaking has got two role plays. So in exam, we will have two role plays and each role play would be different. For each role play, you will be given 3 minutes to prepare. And in this particular 3 minutes, you can write anything on your role play. So you are allowed to write anything, 3 minutes to prepare. Then 5 minutes, we will have to speak. In this session, the most important thing I would like to tell you, sometimes examiners are not having that kind of experience, so they might be reluctant. They might have medical knowledge, they might have not, because obviously they need to act as patient. So as we know in our daily practice, patient might know about his condition, patient might not have an idea. So he might be reluctant, he might be kind of interested to talk. So we have to manage the patient accordingly. So at last we should have this capacity to speak for 5 minutes continuously. That is the main thing I want to say by this point, that at last it's our exam, so we have to be there to speak the best and to carry our task, whether the patient is reluctant. So the examiner who is in front of you or so-called interlocutor doesn't have any marks. He is just a patient. He has no authority of giving you marks. So at last it's all about audio recording. So that is why normally I have developed a habit while teaching. I do not switch on my video just because of this reason. This is the main reason, that basically in OET speaking exam, you will have the audio recording like the way I'm talking to you right now, that is being recorded and that will come to you guys. In the same way, your examination would be recorded and that would go to Melbourne or other areas to be assessed by two individual assessors. So to repeat, you would have two role plays, 3 minutes to prepare for each role play. So you will have one role play, 3 minutes to prepare, 5 minutes to speak, to interact with the patient, to complete your role play. Then again, you will get 3 minutes to prepare for the next role play. Then you again will have the speaking session. So examiner can be reluctant. He's basically just a patient. So you need to just satisfy him as a patient. So we can talk about all the things nicely and can explain them. Okay. And then it comes to this point. Examiner again does not have any marks. He's just a patient and all that. So this is pretty much it about OET speaking. That's why I said it is not difficult at all. It's just about why we are taking coaching, why we are practicing is to be 100% sure that there is no if and but. And if we take the exam and being senior doctors and super specialists, we don't have time to wait for another exam, to fill another exam, and to waste our precious time in this small paper. This paper is very, very valuable otherwise. But if we talk about preparations, it requires precision, because as we discussed yesterday, 180 to 200 words, which primarily means no chances of mistakes, as less as possible when it comes to writing. Grammar should be apt and it should be appropriate. But when it comes to speaking, we can make couple of mistakes in grammar. That's fine, not a problem. But patient satisfaction is the main thing. That means patient should be highly satisfied. Highly means in OET speaking, medical knowledge does not matter because you will get the cue card. If it would have been a test of medical knowledge, they would not have given you the complete role play. They don't want you to speak anything from yourself. Anything from yourself, nothing. They want you to cover the role play, nothing from yourself. What they want is how do you interact with the patient. Like suppose if patient says, I'm having extreme pain, I'm having extreme headache, suppose he says, and you say, okay, I will give you medications. this is not right. First of all, it's about interacting with the patient. That's what they are looking forward to. So if you say headache, I'm having extreme headache. Oh, I'm sorry to hear that, but don't worry. But don't worry, I'm here to help you. So that is what they want, majorly. Of course, we need to talk medical as well. I'm sorry to hear that, but don't worry, we are here to help you. So before we proceed further, these are the lines. Before we proceed further, I would like to ask you few questions. So the normal practice we do in our daily routines, but it's just about making it more refined when it comes to communication. Your practice is already refined, whatever you do, obviously, but now it is about refined communication. That is what OET speaking is all about, refining your communication skills. So before we proceed further, I would like to ask you a few questions so as to assist you in a better way, something like this. You can speak better than me. That's great. So please use your own way as well. So to assist you in a better way, may I? Okay. So first of all, tell me this and this. So that is how you will go forward. First of all, tell me this and that thing. And that is how the role plays would be done. So basically, again, Dr. Amy has just entered. So I would like to repeat 2 role plays, 3 minutes to prepare, 5 minutes to speak. Examiner is just a patient and audio recording would be there. So facial gestures, expressions will not have marks. That means you can see the role play for 5 minutes when you are speaking. You can always look at your role play. So you don't have to speak looking at examiner's eyes. It's just about you can take the help of the role play card anytime. So you don't have to memorize anything as well. Again, in writing, I was just saying that there are no chances that we should make mistake of grammar and we should make complete sentences. But in speaking, we are allowed to make a couple of mistakes. It's just about fluency is the main thing. The way I'm talking to you right now tells about my fluency. Whether if I talk a little slow, but still it tells about my fluency, the command over the language. So they're looking for this command. Medical knowledge is secondary. Attending the patient is primary. So there are various kind of tasks that will come. Sometimes it would be worry management. Worry management means patient can be worried about his condition. Like suppose if her mother had a heart attack at the age of 65 and she died. Now the patient is 62 and has come to you with the same fear that maybe I would die like my mother. So everything would be given. The background situation would be given. So she would also have the same fear, same worries that, I would die like mother. I'm 62 and now I'm having some palpitations, heartbeat. I can feel my heartbeats. I'm feeling. So it can be, again, everything would be given. It would be all psychological task and you would be acting as GP or psychiatrist. It can be anything. So you might be acting as a GP or psychiatrist, then everything would be given, psychologically boost the patient, tell her there is nothing to worry. So everything would be given. So you don't have to worry about these things. But it's about satisfying the patient. Well, say when patients say, oh, I'm really worried this and happen. First of all, so you say, first of all, calm down and have a deep breath. These are the normal things. Obviously, there's nothing to mug up. I'm just saying if I would have been there, I would have done this thing. That is what my priority is. If you have a better way, you can choose your way. But this is what I say when patient is anxious or is worried or is not into his complete senses and is having that nerves of fear running through his, through his body. So I would say, first of all, calm down and have a deep breath. Now, let me know what exactly is bothering you. So these are the things. Now let me know what exactly is bothering you. It can be anything. A mother can come worried about her daughter that she is not eating anything. She's around 16. So she might be having some problem. Basically the case of anorexia nervosa. It can be anything again. We are just discussing examples. It can be that, father was doing his work. He is the sole parent and he could not attend the child is around 6 year old, went into the kitchen, picked up the knife, cut his finger, so he has brought. So it can be a task where you need to say that you need to take care of your son as well. You need to be active because kids are inquisitive, so called curious about knowing things, so they might touch new things and it can be knives. So it is your responsibility to keep the sharp objects away. So it can be these things as well. So being doctors, you might have to do different kind of tasks. You might have to refer the patient to the psychiatrist. So you would say, you are having these and these conditions, you need to see a specialist, a psychiatrist. Then patient will say, do you think I'm mentally sick? Are you all right, doctor? Do you think I'm It can be a task where he can be aggressive. What do you think, doctor? Am I mad? That's what you are saying. You're calling me insane, you are calling me crazy. Then you have to say, see, calm down, it's not like that. These are the things. That is what OAT wants. Calm down. It is not like that. And it would be given. And also, I would like to tell you that psychiatrists are not only for the mental patients. They are also for other people, for the normal people, and will and sometimes they do have depressions and other problems. So it's not about that you are crazy or insane. It's not like that. I'm sorry if you have taken me wrong, if kind of it pinched you, but I didn't mean that. It's all about giving you a better suggestion and looking at your condition at the moment. He is the right expert. Doctor, psychiatrist is the right expert for your condition. So everything would be given. Like if this point has to be spoken, then this point would be given in the role play as that psychiatrist up. It will not be given as a complete sentence. It will be psychiatrist, not only for mental people. That is how it would be given. Common population to example depression and other things. So this would be given as this. You have to make complete sentence. That is what you are supposed to do. And again, see, calm down. It's not like that. Maybe you have misunderstood the situation. So you need to understand it is for the sake of your health. It is for the sake of your benefit, for the sake of your health, that I am recommending you this thing. Because being a doctor, I can see your condition, and at this point of time, taking an expertise, taking an expert help will certainly improve your condition. So it is highly required at this moment. That is why I'm referring you to the psychiatrist. So may I have the consent? So in foreign countries, you have to take consents. So you can say, may I? Or you can say, may I have your consent? So do I have your consent? So these are the small things we talk about. Rest, OET speaking is just as your normal patients. First of all, obviously, you take the history. Sometimes there would be little bit of things you can add on if you want to score A grade. Suppose there can be conditions where wheezing would be given. So obviously, no, patient will not never say that I am having wheezing, because it's a kind of a sign. So you can say, if something like wheezing is given, so always say, first of all, I would like to examine you. So this you can add by yourself. First of all, I would like to examine you. So after examination, then take a pause. First of all, I would like to examine you. May I take a pause? Okay. So now I have examined you. And I have found that you are having this and you are having wheezing, which means that your airways are blocked by this and this and this and this thing. So there are certain things. You might have infection. It can be due to various reasons. So everything would be given. And if they want to talk about infection, so it would be given infection, viral or bacterial, this and that. Everything would be given again. So you need to undergo some tests. This would be given in point form. Undergo tests such as this and this. Everything would be given. So that is how OET role play goes. So you take the history. If any signs are given, you say, first of all, I would like to examine you. May I? Okay, now I have done your examination and I've found that you are having this and this thing. It can be due to this and this reason. So you need to undergo some tests. So as you know, then you make the diagnosis. Obviously, the next step is diagnosis and then the suggestions, preventions and management. So that comes in the last. Prevention and management, as you know, mostly when we tell the patient how to manage, so we always say, I suggest you to do this and this thing. I advise you to do this and this thing. You should do this thing. You need to do this thing. It is important for you. So that is how you can give suggestions at the end of the role play. So these are the 4 or 5 ways. Like, I would like to recommend you that you should do this thing. Also, it is important to do this thing. You should also do this thing along with this. It would be really helpful if you will do this thing for you. So you can use these common bit of things to speak in a better way. So these are the kind of role plays we have when it comes to, you know, orientation of OET. So this is what speaking is all about. Now we will try to take a task and we'll try to see what we can do in a better way. So that is OET. That's it. That is how simple it is. So I'm just going to pick up any task. So now you're in a suburban clinic. You are a doctor. So this is something that would come to you. A worried parent has brought in young child who suffers from eczema to see you. So that is the role play of the day. Find out what the parents want to know about eczema. So first of all, you need to ask, could you please tell me what would you like to know about eczema? Simple. That is how simple OET is. Could you please tell me what would you like to know about eczema? It's just about fluency that will come with practice, and that's pretty much it. And the better we get, the more marks we're gonna get in fluency. Could you please tell me what would you like? What would you like to know about eczema? Or patient might ask himself. When there is a situation that you are unable, suppose if I talk about start, a worried parent has brought in your child who suffers from eczema. So you can simply say, start. Good morning. My name is Dr. Bhupesh and I am here to help you. Or you can say, I'm Dr. Bhupesh. So how may I help you today? So patient will say, doctor, I'm having this and this thing. And my son is having this. Okay, don't worry. So first of all, I would like to know, what do you know about eczema? Then you can explain the condition and talk about the prognosis. So now I would like to explain you that eczema is basically a condition which is connected with the inherited sensitive skin, or it can be in this, basically the skin becomes sensitive or becomes reactive. That is why this disease happens normally. And I would like to tell you more about it, that this disease, this condition, this particular condition can be controlled, but it cannot be cured. That means there would be episodes of on and off when it comes to eczema, but yes, it can be controlled. The symptoms can be managed with the help of different kind of ointments. So and also I would like to inform you that slowly and slowly your child will adjust to these kind of situations. Answer the parent's question about any possible relation between eczema and food allergies. So then parent might ask, are there any kind of, same things that it can be allergy or eczema? Then you can explain, no, it is kind of a different thing. It is not kind of a common allergy that happens due to food. Eczema can be various reasons. It can be environmental. It can be this, it can be that. Then you give advice on the management of the condition. You say, now I would like to advise you that make sure that your child should avoid the things that might irritate the skin. Like most of the soaps which come in the market as commercial soaps do have bit of problems. So in your child's case, the skin is sensitive. So you need to use different kind of soaps, which we will recommend you. Medicated soaps should be used rather than these soaps. Apart from these, wool next to the skin is not really good. So you need to avoid the clothes which are made of wool. So in that case, we will give you different options which can be tried. And also you can keep normally the forearms empty and not wearing anything on the forearms. But if it's too cold, then wool should not be worn. And also we need to teach our child, you need to teach your child now that scratching and rubbing the skin is not the solution. So we will apply the ointments whenever the skin has symptoms, the redness, the itchiness, everything will disappear with the help of, or the symptoms will subside. Subside is a very nice word that I normally say. Symptoms always subside. So these symptoms will subside with the passage of time and by the using the things in this. Again, this role play is not complete enough. If it will come in the exam, then you would be given about this thing. What is the difference? That food allergy is different. This would be given to you. So topic is not a problem. If it comes in the exam, so it would be given, this is different, this is different. It is kind of a eczema condition that can be inherited, that can be otherwise, that can be genetically modulated, that can be environmental cause. So it is idiopathic, we can't really say about the causes, so everything would be given. So talking about this role play, if I have to speak, I will speak it now completely. Good morning, my name is Dr. Bhupesh. So how may I help you today? Well, doctor, I'm here for my son, and he's having a bit of a problem. And doctor, and the last time we came, we were told he's having eczema. So now I have come here as the follow-up appointment to know about eczema. Okay, so before I can go further, I would like to ask you, do you know anything about eczema? Well, no, doctor, I don't have any idea. I can see redness, itchiness, and my son is really irritated, agitated all the time. That's what I know about eczema. Okay, please don't worry. Calm down. Have a seat. Now let me tell you about things. It is a kind of a condition that basically is connected with the sensitive skin. So it can be inherited or it can be environmental, but majorly it happens due to the inherited sensitive skin. So in your child's case, your child is having a sensitive skin. That's why it is reacting, and that is what is causing these symptoms like redness and itchiness. But I would like to tell you these symptoms can be easily controlled. But at the same time, I'm afraid to say that it cannot be cured permanently. So that means there can be some episodes of on and off, but your child will adapt with the passage of time. But yes, there are certain things, certain recommendations which can be followed to make a control over this condition. Especially we can control the symptoms very easily. So we will give you the recommendations. But doctor, is it the same thing like eczema or the food allergies? Well, it is not the same thing. Those symptoms kind of are looking same, but they are actually not the same. So that would be given. Again, I'm saying this would be given. So eczema basically is a kind of a condition that stays permanently, and food allergies are different, that you can avoid food and the allergies will obviously disappear. But in eczema, it doesn't happen. It can be reactive to anything. So skin is naturally kind of reactive. So then I would like to tell you about the management of this condition. First of all, it is very important to avoid things that irritate the skin. So you need to know, you need to keep a check, and your son also needs to keep a check. What kind of things, what kind of clothes are irritating? If I talk about common example, most of the soaps, they irritate the skin when it comes to commercialization. There are certain kind of ingredients which are present which can kind of cause irritation, so we need to avoid most of the soap. So we will give you some medicated soap which will help your son in a better way. Also, the wool next to skin is not really a good idea. Wool next to the skin can cause irritation, so it is important to wear clothes which do not irritate the skin. Apart from this, whenever there are any symptoms, we need to teach your child that he should not scratch or rub the skin, because it further irritates and cause more problems. So these are the common solutions. So are you understanding? Have you understood my point? So the parent will say, okay doctor, I have understood. Okay, now the most important thing I'm telling you, always in OET task, reassurance have marks. Now I would like to reassure you that there is nothing to worry. This is a kind of a condition that can be easily controlled, so there is nothing to worry. If you follow the recommendations, your son will be fine. Also, I am giving you a leaflet which contains all the information about what we have discussed and about eczema. So please go through this leaflet. It will help you to gain more knowledge about eczema. And if there is any doubt, there is a number below the leaflet, so you can use that number to contact us anytime. Is it all right? Okay, then take care of your son. And again, there is nothing to worry, and you can ring us anytime whenever you feel anything that is beyond your control. Okay, here is your leaflet. Take care. Bye bye. That's it. So that is how you execute your role play. So it's kind of different situation that will come in the exam. And one more role play we will do, and then I will take your doubts. And suppose if I take another role play. So yeah, this can be another one. You examine 18-year-old basketball player who has been brought to the surgery today by the team coach because of the severe left knee pain. You diagnose a meniscus tear. So that means there is a torn cartilage. Take a brief history from the patient. How did it happen? So you will say 18-year-old. So I was playing basket and this and happened, and this, I don't know what is happening. Explain the likely diagnosis. So now I need to examine you. After examination, I have found that you are having a meniscus tear. That meniscus tear is basically that you have there are cartilage, which are in our body, and if they kind of break, they cause this kind of pain. So basically, when you were playing, there was a cartilage that got torn. But doctor, what does it mean now? What to do? See, first of all, I would like to tell you there is an immediate treatment that I would like to give you. It is known as rice regime. That means R means rest, I means ice, C means compress, elevation, and refer to the physiotherapist. So we have to follow these things. First of all, I would like to explain this thing. First of all, rest, it will play a very important role in your healing. Second thing is the usage of ice, which is very important to drop the inflammation. Compression will play an important role. Also, you need to keep your leg elevated, and of course, you would be requiring a physiotherapist who is an expert, will give you massages and things to help you in a better way. But doctor, I need the pain medication. Why can't you just give me medication? I know I would be fine. See, it is not kind of a normal pain that you are having. It is a severe pain in your left knee, and that is basically due to the tear of the cartilage. So please understand, only the pain medication will not be effective. So we need to follow this regime. What I have told you as ricer regime, you need to follow this thing. It is very important for you. And also, I would like to tell you that physiotherapist will play a very important role, because he will give you appropriate exercise plan, and also he will tell you about the recovery strategies, and he can give you specific treatments. The precise treatments that are required in this particular condition would be given by the physiotherapist. Is it all right? So should I fix your appointment with the physiotherapist? Okay, doctor, you can. Okay, that's great. So I'm fixing your appointment with the physiotherapist. And also, I would like to suggest you, please do not play sport until the pain completely resolves. Otherwise, if you ignore this thing, if you ignore the advice, there can be complications which can become worse, due to which you might not play even for more time. So I understand you are 18 and you are a basketball player. It's very important for you to play the basket ball, but at the same time, we need to take care when we have injuries. So if you will take proper rest, use ice, compression, elevation, I assure you that it will take less time to heal, and slowly and gradually you would be able to play your game again, and it will take less time. But if you ignore this advice at the moment, then it can be dangerous, it can be harmful, it can lead to further complications, and you might not be able to play for 2 3 months. So please take this advice seriously. Now I'm giving you this leaflet. It contains information about the things, about the kind of injury you have. And also, I'm recommending you to go to a physiotherapist. Further, I reassure you, if you follow the advices, your healing will be faster and quicker. Is it all good? All right, doctor. Then take care. And I'm fixing your follow-up appointment. That would be after a week. Please come and visit. So these are the different kind of role plays we have. So we have discussed two role plays. So I'm just going to stop the recording and we'll take your questions now. Thank you so much for listening to me patiently. Thank you.